Welcome back. So you've just seen an extensive series of videos showing you how psychological disorders manifest themselves in the different categories that are now known and diagnosed by the DSM-5. Many people are somewhat alarmed by these large increases in the incidence of disorders like ADHD, depression, PTSD, anxiety, and autism, and they wonder if this is a result of actually increasing incidence of these diseases, or are we getting better at diagnosing them? Perhaps we've reduced the stigma enough that more people are willing to come forward and claim these diagnoses. Certainly it's true that the change in definitions from each version of the DSM alters how many people might be diagnosed. For instance, one of the very controversial changes in the new DSM-5 is the removal of the bereavement exception. That is, in older editions of the DSM, when considering symptoms of depression, if the person had suffered the death of a loved one, such as a spouse or parent, within the last 2 months, a diagnosis of depression was not given, because that was considered normal to undergo these feelings in the case of extreme bereavement. However, the new DSM-5 does not offer that exception, and so a person who may be greatly saddened a month or two after the loss of a parent could legitimately be diagnosed with depression. And there are those who think that is a medicalization of the normal conditions of life. And finally, there may be other reasons why these disorders might be overdiagnosed, or if not overdiagnosed, why the number of diagnoses are increasing. One of those is that the available treatments are increasing. We know now that cognitive behavioral therapy works well at reducing symptoms of anxiety and mood disorders. A lot of the drugs available have low side effects profiles, and so even if they don't work, they don't do much harm. And insurance is increasingly likely to cover both behavioral therapies and pharmacological therapies. All of these leads to a larger number of people being diagnosed. And finally, there's been a big push in the last 10 or 15 years to legitimize psychology and psychopharmacology as a medical science. And this can be seen in the widespread advertising for psychological drugs, the great prevalence of the chemical imbalance theory, which, as I've said, is really a myth of how depression is caused, and other aspects which lead people to believe that pharmacology is the answer to their questions, and if there is an answer, then they're more willing to be diagnosed. As we'll see next week when we talk about treatments, there's some truth to these arguments, and also some reasons for hope that pharmacology might provide good treatments for a lot of previously untreatable disorders. So as we've seen, there are a lot of ways for the mind to go wrong and for mental health to go down a bad path. However, as we'll cover in treatment next week, there are increasingly more and more ways we have of attempting to restore mental health to people who have mental disorders. Thanks for your attention. Don't forget to take the quiz at the end of this session to get your full clicker points, and I'll see you next week.